This being one of my first YouTube videos, I think it makes sense to start off with a little foundational information. For today, that'll be about gut microbiome testing in the athlete. My hope is that this video helps you save some time in your search for stool testing options to look at the gut and gut health in the athlete. That's important because, as many of you know, the gut microbiome is highly metabolically active and it is either working for us or against us in terms of all the metabolic activity that it possesses. The gut communicates with the musculoskeletal system, our nervous system, our immune system. Really, directly or indirectly, it touches every body system. So if we can straighten out gut function, we can often make significant progress in the health of the athlete. Stool testing can give you a new tool in your clinical toolbox. However, there are some nuances that are going to be really helpful to keep in mind as you pick a stool test to utilize with your athletic patients. So today we'll talk about the two different general categories of stool testing, conventional and specialty, and we'll talk about what they tell us. Let's get started right now. Generally speaking, we can break stool testing down into two categories: conventional stool tests and specialty stool tests. The conventional stool tests usually have a pretty narrow scope, meaning they are just utilized to answer a specific clinical question. Does the patient or athlete have a parasite? Do they have a C. diff infection? Is there hidden blood in the stool? Sometimes it's used for colon cancer screening. And all of those purposes are valid. The patient presentation or athlete presentation usually consists of some kind of GI symptom: abdominal pain, loose stools, diarrhea, or maybe even an asymptomatic patient who's getting the test for screening purposes. We typically don't get much of a microbiome assessment in conventional stool tests. Usually, the organisms identified are typically pathogenic if that's what's indeed tested. The methodologies will match the clinical question, so it's usually a single methodology employed in conventional stool tests. Clinical interventions will usually involve some kind of treatment for infection or maybe a referral to a gastroenterologist for additional workup, depending on the findings. The specialty stool tests are often varied. Some are broad collections of biomarkers that include some conventional markers and some specialty biomarkers, and then others are just focused on a single method looking at microbiome. Generally, the athlete or patient presentation would include some kind of gut symptoms, mood issues, skin issues, although some of them are asymptomatic completely. And the really good specialty stool tests will involve a broad array of biomarkers related to the gut microbiome. That would include assessment for pathogens, potential pathogens, and commensal and beneficial organisms, either in part or in the entire microbiome. The methodologies, well, typically they involve multiple methodologies, but some tests do employ just a single method. And the clinical interventions could involve things like therapeutic diets, dietary supplements, antimicrobials, probiotics, digestive support, etc., and even lifestyle modifications, and in some cases, even prescriptive treatments. Depending on the findings, you might still make a referral to a gastroenterologist depending on what's found in the report. Let's take a look at a specialty stool test here. This is the GIFX from Genova Diagnostics. Full disclosure, I also work in the medical affairs department at this laboratory, and this test was designed with the input of myself, key opinion leaders in the field, and the rest of the medical affairs team at Genova. In this report, we see a 29-year-old female athlete. We can see that she's struggling primarily with dysbiosis, but there's also a sign of maldigestion and some infection. But the big issue was dysbiosis. The second page of the report, we can see that there is some overgrowth in the commensal bacteria. These are bacteria that make up part of the gut microbiome. Here you can see they are overgrown. On the third page of the report, we can see the gut flora are out of balance. That's often due to a lack of the beneficial flora or an abundance of the less beneficial flora. In this case, it appears like it's due to the overgrowth that we saw on the previous page. More on that in a moment. On page 4, we'll see that, yes, there are some markers related to digestion and absorption that are of interest here. There's evidence of some fat maldigestion. We can see that here. The fecal fat total is high. There it is right there. You can also see that pancreatic elastase looks normal, but when you see fats elevated, sometimes it makes sense to consider some enzymes. Inflammatory markers looked okay. No elevations in calprotectin, which is a neutrophil type of inflammation, pretty serious type of inflammation. But all of the inflammation and immune markers were not elevated there. Moving into page 5, we're looking at the commensal bacteria. These are bacteria that make up the part of the microbiome, 24 key players in the microbiome. Here you can see most of those black diamonds are shifted to the right there. Just another way to look at the overgrowth. We can even see overgrowth among some of the beneficials like lactobacillus, that was high. Veillonella, it was not low, it was in the third quintile. Bifidobacterium, almost high. Akkermansia down there at the bottom of the page was almost high as well. So there is just another way of looking at the overgrowth here. In the culture, we see that the lactobacillus did not grow, which isn't really surprising for lactobacillus. We don't often see that show up in the culture. The bigger issue was that the mycology culture, we can see some candida showing up in 2 out of the 4 quadrants there, which candida can lead to loose stools, constipation, sugar cravings, brain fog, fatigue. And when it matches the clinical picture, as it did in this case, it becomes the primary target for treatment pretty often. On page 7, we can see parasites. This was a blastocystis, probably the most common parasite that we see in stool test results, especially in the athletes. Rare, few, moderate, many. That's the reporting scale. And so in this particular case, she was in the upper middle part of that qualitative scale there. That was confirmed with the PCR probes on page 8 of the report. So just 2 different methods looking for parasites just offers some extra reassurance. We can also see fecal occult blood was negative. So that's one of those conventional markers that's integrated into this test and really helpful to see. Macroscopic exam, that looked okay. Sometimes we can detect undigested food there. This is the sensitivities for the Candida albicans. As you can see, voriconazole and fluconazole provided inhibition almost all the time. Nystatin performed pretty well. Looks like we're seeing some moderate inhibition here for nystatin, undecylenic acid, uva ursi, but higher inhibition for garlic. So that looks like a pretty good choice. I like allicin for that. It's an extract of garlic and has one of the most active constituents in garlic, which has antimicrobial and antifungal effects. So, of course, with as a healthcare provider, treatment decisions are always up to you, and they're best made with the patient's clinical history in mind. As we sort of circle back to the beginning and think about these therapeutic support options, antimicrobials were kind of one of the key interventions there. Digestive enzymes, I think we can still make a case for it, given that there was some fat maldigestion. And as a second step of treatment, maybe bringing in some pre and probiotics. That's usually a safe bet after using antimicrobials, even the natural antimicrobials. It's often a good idea to think about bringing in some pre and probiotics. So, just a quick tour of a specialty stool test. We saw the gut microbiome. This is one of my favorites, the GIFX Comprehensive, and we'll see a lot more of these on the channel as I post more videos. I hope that gives you at least a general sense of what's out there stool testing wise. If you're looking to dive more deeply into this topic and start incorporating these valuable tools into your clinical management of athletes, check out our online course. It's a great resource, everything from specimen collection all the way up to results interpretation, and feature some of the best stool tests out there, like the GIFX Comprehensive and the microbiomics from Genova Diagnostics. Thanks for watching, and I'll see you in the next one. Take care. Bye-bye.